And it is 101.1 FM, AM 1160, WCCS at just about 11 minutes after 9 o'clock. Dr. Pat Shannon is on the line with us this morning. Always good to catch up with him, find out what's going on with IRMC, and in particular with IRMC at Chestnut Ridge. Our conversation is brought to you this morning by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Dr. Shannon, good morning.
Hi, good morning, Todd. How are you?
Wonderful. It's good to have you on the air with us once more.
Thanks for having me back, Todd. Appreciate it, as always.
Making it through the winter okay, I presume, and Chestnut Ridge, there's a lot of business going on down there, isn't there?
Yeah, there is. We've had quite an uptick over the last month in flu-related cases, RSV. Both of those seem to be, fingers crossed, kind of winding down a bit. We are still seeing some fair numbers of COVID, and then a lot of other viral syndromes, strep, and kind of the run-of-the-mill winter illnesses.
Yeah. With COVID, of course, there's this new variant that is out there that they say is very, very aggressive. It doesn't seem particularly more viral than some of the other strains that have been out there, but certainly very aggressive and beginning to take over as the number one COVID variant that is afflicting people right now. Have we noticed an uptick in that particular strain here, or even testing for the type of strain that it is?
I think that the Department of Health continues their due diligence on identifying which strains are in the community. I think the newest strain that's out there, we certainly likely have that in the community as the dominant strain. We have not seen a significant uptick in people hospitalized with serious illness. We still do see COVID on a daily basis here at the Urgicare. We are still making that diagnosis. But it's nice because we're not where we were, a year, 2 years ago. We do have the oral antiviral therapy that we can prescribe out of here that significantly reduces the worst that COVID has to offer. So I feel we do have a better handle on the situation right now. But I think people still need to keep their guard up, Todd. I mean, COVID is here. It's here to stay. It does cause serious illness in some populations, in particular our immunocompromised patients and elderly. But it still can, from time to time, really affect somebody under the age of 50 in a drastic way.
Yeah, it really can, and especially when combined with some of the other maladies that we have going on right now. And there are just so many of them out there, and protecting ourselves is one thing, and we can talk as much as we want about loading up on the vitamins and doing whatever we can to prevent having it. But, sometimes we're just going to get it. We're going to be exposed, and we're going to come down with it. IRMC at Chestnut Ridge and IRMC main campus, of course, very concerned with that and treating people for it. So what's the latest on how we should how we should approach it when we suspect that we have it and when we use our medical facilities?
Yeah, so if you suspect you may have COVID, you should take the time and go get a test performed, because we know that people that test early and that are diagnosed early may be a candidate for one of the oral antiviral medications. Those medications have to be started within 5 days, and that's why time is of the essence. And in particular, in the elderly, those with a weakened immune system, it's real important to differentiate what is going on. So I really would recommend those populations in particular, if you're feeling ill. And really the number one complaint now that we're seeing with the new variant out there is the fever and body aches. Back in the early portion of this pandemic, loss of taste and smell was a real predominant symptom. We don't really see that much more. It's a lot more sneakier at this point in time. And it really, the flu season really confounds it even more, because influenza, some of their the number one feature with that is cough, but followed by body aches and fever. So, I'd recommend, if you have symptoms, it's best to get a test performed, because you very well may be a candidate for an antiviral therapy.
And at IRMC at Chestnut Ridge and at main campus, you have rapid testing, right?
Yeah, that's correct. We offer at the Urgicare in Blairsville and at the walk-in clinic that's open 8 to 5 on campus. We do offer it's one single test, one swab, and it's a test for both COVID and the two strains of flu A and flu B. And that test can be performed at both of those sites. Results typically come back in anywhere between 5 and 15 minutes, and that gives us some information to go on. We may, even with a negative rapid test, propose that we do a PCR test and send up to the hospital for confirmation. Mm-hmm. But I love the fact that we have this test now because we can get people treated or diagnosed and treated in a more rapid fashion, which really seems to make a difference.
Yeah, and with the Urgicare especially, that seems to be, it just fits the profile. It's right there in the mission for Urgicare there at IRMC at Chestnut Ridge. So for people who aren't aware of it or need a bit of a refresher course on what happens there with Urgicare, why should we be visiting an Urgicare as opposed to an ER or a primary care physician? What is Urgicare's role?
Yeah, so it's kind of interesting, Todd, and I was thinking about this morning. If you look at the IRMC family, we have an urgent care. We have an emergency department. We have primary care physicians. We have the walk-in clinic, and we have specialists. Where the urgent care fits in that circle is for an individual that has a complaint that they really feel is not emergent. Like, you wouldn't want to come to the urgent care if you're having signs of a heart attack, chest pain, extreme shortness of breath, kind of the extremes of any symptom. Those really should be evaluated in the emergency department. However, if your complaints you feel are mild, cough, cold symptoms, sprains, strains, back pains, mild abdominal pain, we're here for you. That's in our wheelhouse. And, here we have on-site x-ray. We do some rapid testing here. But the other nice thing about it is we can order pretty much any lab that we want and have that ran through IRMC at the hospital and have those results back in 24 hours. So, and then the other nice thing about Urgicare is we work hand in hand with the emergency department, with the specialists, with the walk-in clinic and the PCPs. So it's really a continuum of care. When you enter the urgent care, you actually kind of enter the entire IRMC family of healthcare providers.
Yeah, it closes the circle, doesn't it?
It really does.
Yeah. And the availability of doctors, I think, is a really key part of this equation as well. The fact that there are doctors available and that you're so tied in with IRMC and the total care concept, it's really an important thing.
It is an important thing. We have board-certified physicians here 12 hours a day. There's a fair number of urgent cares and urgent care systems in the United States don't staff it that way, but we actually staff a board-certified physician as well as a nurse practitioner and physician assistant. And I think in doing so, it elevates the level of care that patients actually receive here. And I can't say enough good things about the staff that I have here. My lead nurse supervisor, Dan Jorgensen, another local guy, he does a great job here, and our entire nursing staff, I think, is really one of the key pieces of the entire urgent care experience.
Yeah, absolutely. In fact, I know of many people who say that just for the way that they do things there at IRMC at Chestnut Ridge, I'm driving there. So you get people that actually come great distances just to go to Urgicare at Chestnut Ridge.
We do. We have quite a few people that come out of Johnstown. We see a lot of patients out of Seward, Evansburg, northern Cambria. People come from all around. And I think that just speaks to our nursing staff and our providers. Listen, I will tell you this. Things have been very busy. And I really appreciate it when patients are patient because pretty much the entire healthcare system right now is really busy. So I will say this. There may be a wait sometimes when people come down. But I think the wait is going to be well worth it because I think the quality of care in the end, people are going to be very happy with.
We're talking with Dr. Pat Shannon today about Urgicare at IRMC at Chestnut Ridge and at the IRMC Total Healthcare Picture from the main campus to the various sites, and Urgicare certainly is a big part of that. You did talk a couple of moments ago about the primary care walk-in clinic, and when it opened earlier this last year, I guess I have to get used to saying last year, when it opened last year, I thought, what a neat concept for people who don't really have a primary care physician and really haven't taken that step. The primary care walk-in clinic is a real great advantage, isn't it?
It is a really great advantage. And once again, if you look at the continuum of care that IRMC is offering, it's another cog in the wheel. And the walk-in clinic's open 8 to 5 right now, Monday through Friday. Those hours are likely to expand into the weekend and even later on in the evening. And, if you don't have a primary care physician, or if you have another mild ailment, you live local, that is a great opportunity for somebody to be injected into the IRMC family of care. You can get to the clinic. They have friendly staff. It's very well staffed. We've had a great response from it. And if you don't have a family physician, after that appointment, when you leave, you will. You can be either connected to one of the other IRMC PCPs and align your care with them. And once again, I think that's just very important because when you go to the IRMC walk-in clinic or the urgent care, we have the capability to pick up the phone and talk with one of our local healthcare providers, one of our local family physicians or internal medicine physicians, and tell them, hey, I have a patient here that really needs a family doc and has this problem. Would you be willing to see them? Mm-hmm. And 100% of the time they're like, yes, and here's their appointment time. So it's been absolutely fantastic. In the walk-in clinic, I just couldn't be happier with the providers that are there, the nursing staff, the front office staff. It's been an absolute success.
It's a great resource. Speaking of resources, we should mention as well that IRMC at Chestnut Ridge, Urgicare is one element of several that you have there. And I always emphasize, when I do the live spots during sports broadcasts, I always emphasize 3D mammography is available there. It really is a great advantage for people not only from that southern Indiana County region, but all of the region surrounding.
It really is. If you had a prescription, say if you don't even have an IRMC doctor, but you needed blood work done and you lived local, you can come here to Chestnut Ridge and have your blood drawn right here local. If you need an X-ray, an EKG, and then, in-house, we do have pediatrician, Dr. Valias, here as well. We have dermatology down the hallway now. The Dr. Klein, Heasley, and Nettleton group is in-house. We have physical therapy, which is a great success. So we do offer a lot of other services other than urgent care. The other thing I would like to add, Todd, is along with urgent care, we do run an occupational medicine service, and we service injured workers. We do pre-employment physicals, pre-employment drug testing, and so forth for our employers of Indiana County. So we also offer that service concurrent with urgent care.
Yeah, man, that's a lot of offerings there. IRMC at Chestnut Ridge, and we've caught up this morning with Dr. Pat Shannon, who has a pretty darn busy schedule. So we're very appreciative of the time that you've spent with us this morning, and thanks so much.
Hey, thank you, Todd, and have a great day.
You too. We'll catch up with you shortly. It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160.